Loratadine Claritin 10 mg, Claritin Tablets 24-hour. One non-drowsy tablet effectively relieves allergy symptoms all day, any day. Overview: physician recommended non-drowsy oral allergy brand. Non-drowsy relief against pollen, mold, dust and pets. Claritin provides relief of symptoms that can be triggered by over 200 different allergens. Claritin is an antihistamine, so it hinders the cascade triggered by allergens. Temporarily relieves runny nose, sneezing, itchy, watery eyes, itchy nose or throat. Claritin Tablets. This insert contains basic prescribing information only. For more comprehensive information, a professional brochure is available to physicians upon request. Long-acting, non-sedating antihistamine. Description: each Claritin tablet contains 10 mg micronized loratadine and the inactive ingredients cornstarch, lactose and magnesium stearate. Action: loratadine is a potent long-acting tricyclic antihistamine with selective peripheral H1 receptor antagonistic activity. Indications and usage: Claritin products are indicated for the relief of symptoms associated with allergic rhinitis, such as sneezing, nasal discharge, rhinorrhea, and itching, as well as ocular itching and burning. Nasal and ocular signs and symptoms are relieved rapidly after oral administration. Dosage and administration: adults and children 12 years of age and over. Claritin tablet, 1 tablet, 10 mg, once daily. Children to 12 years of age and with body weight 30 kilograms. Claritin tablet, 1 tablet, 10 mg, once daily. Drug interactions: when administered concomitantly with alcohol, loratadine has no potentiating effects as measured by psychomotor performance studies. Increase in plasma concentrations of loratadine have been reported after concomitant use with ketoconazole, erythromycin or cimetidine in controlled clinical trials, but without clinically significant changes including electrocardiographic. Other drugs known to inhibit hepatic metabolism should be co-administered with caution until definitive interaction studies can be completed. Drug laboratory test interactions: Claritin products should be discontinued approximately 48 hours prior to skin testing procedures, since antihistamines may prevent or diminish otherwise positive reactions to dermal reactivity indicators. Adverse reactions: Claritin has no clinically significant sedative properties at the daily recommended dose of 10 mg. Most commonly reported side effects include fatigue, headache, somnolence, dry mouth, gastrointestinal disorders such as nausea, gastritis, and also allergic symptoms like rash. During the marketing of Claritin products, alopecia, anaphylaxis, abnormal hepatic function, tachycardia, palpitations, and dizziness have been reported rarely. Contraindications: Claritin products are contraindicated in patients who have shown hypersensitivity or idiosyncrasy to their components. Precautions: patients with severe liver impairment should be administered a lower initial dose because they may have reduced clearance of loratadine. An initial dose of 5 mg or 5 ml once daily, or 10 mg or 10 ml every other day is recommended. Efficacy of Claritin has not yet been established in children younger than 2 years of age. However, the pharmacokinetics profile of loratadine in infants 1 to 2 years of age after the administration of a single 2.5 mg dose of Claritin syrup is similar to that in older children and adults. Usage during pregnancy and in nursing mothers: safe use of Claritin products during pregnancy has not been established, therefore, use only if the potential benefit justifies the potential risk to fetus. Since loratadine is excreted in breast milk and because of the increased risk of antihistamines for infants, particularly newborns and premature infants, a decision should be made whether to discontinue nursing or discontinue the drug. Overdosage, somnolence, tachycardia and headache have been reported with overdoses. A single acute ingestion of 160 mg produced no adverse effects. In the event of overdosage, treatment, which should be started immediately, is symptomatic and supportive. Treatment: consider standard measures to remove any unabsorbed drug in the stomach, such as adsorption by activated charcoal administered as a slurry with water. The administration of gastric lavage should be considered. Physiologic saline solution is the lavage solution of choice, particularly in children. In adults, tap water can be used. However, as much as possible of the amount administered should be removed before the next installation. Saline cathartics draw water into the bowel by osmosis and, therefore, may be valuable for their action in rapid dilution of bowel content. Loratadine is not cleared by hemodialysis to any appreciable extent. After emergency treatment, the patient should continue to be medically monitored. Storage: please see carton. Keep out of reach of children. Further information can be obtained from the doctor or the pharmacist. Bayer. Click subscribe to Users Productions YouTube channel.